I'm Prashant Yadav. I'm the Director of Healthcare Research Initiatives at the William Davidson Institute at the University of Michigan. The FDA sponsored this report at the Institute of Medicine because there were several events in the past where poor quality or counterfeit or falsified medicines were entering the United States, were serious risks to the population in the country, but also globally this remained to be a big challenge. So the FDA was keen to understand what could be done by them, but also with the cooperation of the global agencies. So it's hard to quantify the extent of the problem, primarily because the definition of what is considered a counterfeit product or a substandard or a falsified product has not been clear in the past, and many countries have reported case studies, but then we can't say whether this was falsified or substandard. But I think over 100 countries have reported case studies where a product, a pharmaceutical or a health product, which was of low quality or spurious quality, was found in the system and had impacted the health of their population. So I think it's important to separate falsified drugs from substandard drugs, and I think the committee does a good job describing or clearing up the definitional issues. So counterfeit drugs are where there is a trademark infringement, which means somebody by intent is making a product which is not the original product and is sending that product into a market. That was the example of Avastin for the US. And the ways to prevent that from happening are to have a better track and trace system in the international supply chain. So anything that enters or any product, every time it changes hands from one commercial entity to another, that transaction ought to be reported. It ought to be recorded, and someone should be analyzing it to detect trends. So the report recommends a mandatory track and trace system for the US, which the FDA should establish, and the Congress should authorize the FDA to do it. That's the recommendation from the report. And I think having measures like the track and trace and extending that globally and also working with other regulators who should have track and trace in their countries will then create a system where we can detect any product like the one that you described before it enters the United States, or even much before in the global system. And many countries have already started doing that. So interestingly enough, Turkey has already started a mandatory track and trace system for all products that are made and sold in Turkey. And the European Commission is also starting on similar initiatives soon. So I think as all of the agencies get together and think about track and trace, this could help us eliminate the problem to a large extent. Yeah, so in simple terms, every secondary package has a unique serial number so that you can identify where the product started and where it is at any given point. And it is similar to the tracking system that you see for FedEx packages. So that system does not exist now because it's not federally mandated, and there are some states such as California who have enacted a law which will require manufacturers to do track and trace in 2015. Other states are thinking about it, but there's no federal mandate on it. So in some select geographies that happens, but it doesn't happen nationwide. So I think we have to understand the nature of the pharmaceutical manufacturing system, primarily because most of the active ingredient manufacturing today happens in China or India. And what that means is products which are the finished products, irrespective of where they're manufactured, the active ingredients is most likely getting manufactured in India and China. In many cases, even finished products are getting manufactured in India, China, other regions in the world. So given that the sources and places where medicines are manufactured are located in India and China, we would see a lot of product that is coming in from those locations, also contributing to the problem of counterfeit and substandard and falsified medicines. But like I said before, I think it's widespread, and it doesn't impact one country alone. It enters the supply chains of countries from places that we do not imagine, and therefore it's a global problem in its true form. One country's counterfeit problem leads to problems in another country. So the report doesn't get into the trade and economics aspects of pharmaceutical manufacturing, but I think one thing we stress is FDA alone cannot inspect all of the facilities, all of these sites which are now involved in a global supply chain. And this means that the FDA will have to work much more closely with international agencies. So even though it's a daunting task and it requires international agencies and many different stakeholders to cooperate, but I think there are some specific ideas we lay out in the report which can help get us closer to that point. One of them being, if there are detection technologies which can help detect low quality product that is in the supply chain, and these technologies are more suitable for use in resource constrained settings, regulatory authorities in countries which are low and middle income can use those technologies, then I think we have a chance of at least reducing the problem at its origin. The second very concrete part we suggested is regulatory authorities in lower and middle income countries and also countries which are large manufacturing bases today, if they were to create a plan on how they will meet international quality standards, that could be a useful exercise. And then within that plan, we could see things such as joint inspection reports, so that if one regulator is inspecting a facility, how can the inspection reports be standardized so that they can be shared across the regulators? Similarly, when products are registered in a country, can we have a common set of documents so that each regulator can view them without having to duplicate efforts? So some of these are very concrete ideas which I think can happen and get us closer to where we ought to be. But some of these, like you said, would require political cooperation, international cooperation, which are not always easy to achieve, but are still something we ought to continue working on. I think we observed that as a trend. The report clearly said the complexity is increasing and has increased dramatically in the last 2 decades. Whether or not it's a trend that is going to continue, or what are the economic drivers behind that trend, are things we didn't delve deep into. But one thing we focused on quite well in the report is, if we assume that global supply chains for medicines are going to become complex and remain complex, because the nature of modern manufacturing is such that it is fragmented and it happens in multiple locations, and in the arguments of core competency and what one location can do best versus another, they always apply. So our best bet is to ensure that the complexity is matched with better regulatory methods and regulation which can work in tandem, in synchronicity with the complexity that is developing. So, for example, the Avastin example that you cited, which means a drug is manufactured in Singapore and goes through a couple of steps before it reaches US populations, doesn't necessarily mean that we cannot put in place a robust method for ensuring the quality of that drug. So I think the report focuses more on how can we ensure quality in an environment where complexity of manufacturing is increasing or complexity of supply chains are increasing.